Welcome to Savitha Dental College Lecture Cast on Prosthodontics, Jaw Relations Part 2 and 3. This involves fabrication and customizing occlusal rims. Occlusal rims can be fabricated either by the roll technique or using prefabricated rims that can be modified to attach to a denture base. The anterior part of the occlusal rim should be proclined by 15 degrees and should be as high as 22 millimeters from when viewed from the sulcus of the canine area. Posteriorly, it should have the occlusal rim should end at an angle of 45 degrees as shown in the figure and should have a height of 12 millimeters from the crest of the ridge or 18 millimeters from the sulcus. Whereas the lower occlusal rim will be 18 millimeters from the sulcus in the canine area. The anterior part can be tilted by 15 degrees or can be kept a little less, 7 degrees is fine. And the posterior part of the lower occlusal rim should end at 2/3 the height of the retromolar pad. Here you can see the upper occlusal rim getting over at the 2/3 the height of the retromolar pad. So next step in jaw relation would be to customize the occlusal rim. So customizing the occlusal rim is a simple clinical procedure, but it's essential to make the occlusal rim suitable for a particular patient. So first we have to insert the denture base and make sure that they fit well. And once the denture base is inserted, the patient should be asked to smile. First you ask for a light smile and then an exaggerated smile. So based on the way the patient smiles, you can mark the lower lip line for light smile and high lip line for the exaggerated smile. The exaggerated smile would mark the point where the height of the incisors would be complete. So that can act as a guide for selecting the teeth. Next we'll have to check for the plane of the occlusal rim by checking with the Fox plane and seeing if it's parallel to the interpupillar line. Posteriorly, we can check it with the campus plane or the alar tragal line. And next is we should make sure that the upper occlusal rim, once it's customized to these specifications, are not adjusted. And then we'll have to adjust the lower occlusal rim until there's even contact. As you can see in the picture, the upper occlusal rim is much bigger than the lower occlusal rim. That's because once we freeze the upper occlusal rim based on the smile line of the patient, we should not alter it, and only the lower occlusal rim should be adjusted till we get the optimum vertical dimension. Thank you.